Hello everyone, and welcome back to the second session of the 2020 Chopwright Summer Learning Series. Today we are excited to welcome Catherine Parker, Michelle Phoenix, and Nadia Tennell to the virtual stage. During the session, they will discuss their project, which involves the use of simulation modeling as an educational tool, targeting research teams and patient partners to co-learn and address complex challenges that can be experienced in the conduct of patient-oriented research projects. During the interactive session, you will get to experience two of these simulations that are currently in development to get a sense of how this tool can support engagement efforts within your own projects. As a disclaimer, just because these products are still in development, the webinar recording will not include those simulations, but stay tuned. They will be launched in the near future. So with that brief introduction, I'll hand over the virtual podium to Catherine, Nadia, and Michelle to dive right into the content of today's session.
Thank you, Pierre. My name is Nadia Tennell, and I am one of the co-PIs on this project, along with Dr. Catherine Parker and our co-investigator, Dr. Michelle Phoenix. We're going to skip sort of a lot of the bios because we do have a very full agenda today and we want to get to this simulation. So it's so great to be seeing everybody online today. Thank you so much for taking the time to join our session, and we're really excited to be able to share with you some of the simulation work that we have done over the last year. And I think we're particularly excited because this is really new and novel to us in a few different ways. Firstly, Holland Bloorview has had significant experience with simulation and client and family integrated care and using simulation as a tool to support learning in that area. But this is the first time we've leveraged the simulation tool for family engagement in research or patient-oriented research. So we're very excited to be able to share that with you today and get some of your feedback and initial thoughts on the work that we have done. And the other thing we're excited about and we're probably a little bit nervous about is doing this virtually. This is the first time that we have used simulation in a virtual environment. Typically when we do simulation, we do it live. So this is new for us, and so we thank you for your patience and understanding as we work through that as well. But I think it's a great opportunity, given the new environment that we're all in, to be able to learn through virtual means like this. So excited to be able to get started. As you are probably aware from the agenda that was circulated earlier, we're going to spend the majority of the time in actual simulations. We're going to do a live simulation and we're going to show you a video simulation as well. But before we do that, we just wanted to set the stage and the context for the work that we've done and share with you how we got to where we are today. So I'm going to start and then I'm going to pass it over to my colleague Michelle and then to Catherine to continue. So for context, for those of you who are not familiar with Holland Bloorview, both Catherine and I work at Holland Bloorview Kids Rehabilitation Hospital. Catherine is the senior director of teaching and learning, and I am the director of research growth and expansion at the hospital. And we're fortunate to have Dr. Michelle Phoenix as an adjunct scientist at the hospital. And so Holland Bloorview is Ontario's only inpatient pediatric rehabilitation hospital, and we're focused on creating the most meaningful and healthy futures for children with disabilities and their families. At the hospital, we provide both inpatient and outpatient care for children with disabilities, medical complexities, and those that are requiring rehabilitation after trauma or injury. The children that we see at Holland Bloorview have over 100 different diagnoses, including acquired brain injury, autism spectrum disorder, cerebral palsy, muscular dystrophy, just to name a few, just to give you a context of the environment in which we're working and the environment in which we're engaging clients and families. We also have an on-site research institute, our Bloorview Research Institute, and the Research Institute is really dedicated to transforming the future of childhood disability through research. And there are 3 domains in which we focus our research. One is exploring human dimensions of care and disability. The second is developing and improving interventions, and the interventions that we conduct and we research at Holland-Bloorview are very broad, anything from psychopharmacological to rehabilitation, OT, PT, SLP, social interventions, educational interventions, vocational interventions. It really it takes the broad approach, and we're fortunate to be able to work with a variety of colleagues and professionals, from MDs to allied health professionals, as well as sociologists, psychologists, and engineers. And the last area of research that we focus on is understanding developmental diversity and that brain-body interaction. So that just is hopefully a very brief overview of where we're coming from. And at Holland-Bloorview, we have a long history of engaging our clients and families in their care, as well as in their research, in our research. But it wasn't really until about 5 years ago that we started to really operationalize the research, family engagement in research, and define it as, for our sake, and I'm sure many of you define it in very similar ways, but as engaging clients and families beyond the role of a research participant, but as partners in all aspects of the research process. And what you're seeing on the right-hand side of your screen is our research engagement framework. This is actually a new and revised framework that we have just hot off the press. We just worked through with our clients and families and our researchers. And what you're seeing here is that families play three key roles in research at Holland-Bloorview. They act as advisors, they act as educators, and they act as research partners. And they can act in any of these capacities in one or more areas or phases of the research process. And that's what we are sort of conceptualizing with that circle on our framework there. And although, we have been doing this for quite a while, like I'm sure many of you have as well, we still encounter many challenges. It's still a relatively new field. The literature is relatively in its infancy as well. And what we're finding and what we're hearing from our clients and families and from our researchers and what we're seeing in the literature is one of the challenges that all parties are facing is that lack of understanding or skills. And when we talk about this lack of understanding or skills, we're not talking about, not understanding what partnership is or what engagement is. I think that's fairly clear. But what becomes challenging is how do we meaningfully and authentically partner with clients and families and researchers. And this becomes a little bit more complex because, for example, there are challenges with empowering clients and families to share their stories and share their experiences. How do we elicit meaningful feedback from clients and families? How do we address those opposing views or opinions? How do we leverage different skill sets? And, we're bringing two very different and diverse groups together to partner, each coming from very different places. And how do we leverage that? And how do we really make the most out of those rich experiences and skill sets? And so when our team looked at this challenge, we saw that, the challenge is very relational in nature. It's the common themes that are coming up with this challenge are trust, reciprocity, communication, respect. And we looked at the literature and we looked at the training modules, and we felt that there was a gap in dealing specifically with these relational complex challenges that researchers and clients and families are facing. And so we brought together a multidisciplinary team, including researchers, family leaders, youth leaders, research team members, and a very experienced research manager as well. And we asked the question, what training would be best suited to address this challenge, to build the skills and understanding that researchers and clients and families are looking for in order to support that authentic and meaningful And the answer that our group came up with as a possible solution to this challenge, or part of a solution to the challenge, is simulation, co-designing, co-building, co-learning through simulation. And so what we did was we leveraged Hull & Broview's in-house expertise in simulation through Catherine Parker, and we developed a set of guiding principles, mapped out some areas of tension, and then used a co-design approach to build our simulations. I'm going to walk through this a little bit in a little bit more detail for you now. So the first thing that we did was we understood from our experience using client and family integrated care simulations that we needed to ground our simulations in guiding principles. And we appreciated and understood that, you know, there's a lot of literature out there on guiding principles. We went to the Authority, PCORI, Evolve, and SPORE, and our team looked at all of the guiding principles that existed, and we customized the guiding principles for our environment. And so the 5 guiding principles that we have based or grounded our simulations in are inclusiveness, co-development, transparency and information sharing, support, and mutual respect. So you'll see as we go through the simulations later on in the presentation that each simulation is grounded in one or more of these principles. Then what we needed to do is we needed to, as a team, understand some of the areas of tension or some of the challenges that researchers and clients and families are facing when partnering during the research process. So the first thing we did was try to identify a roadmap for the research process. And we appreciate that, you know, the research process is not always linear. In fact, it probably is most often not linear. But for this exercise, we created distinct phases within the research process. And then we worked as a team to share experiences and some of the challenges that our diverse team was experiencing when engaging with clients and families. And then we mapped them onto the research process. So you'll see the 4 areas of tension that we felt, you know, that rose to the top, that were common themes across everybody. And the first is right at the beginning of the research process when we're establishing research questions or objectives. There can be disagreement between research team members. There can be different priorities, different sort of people coming from different places and having different value, different objectives and research questions. And so how do you navigate that in a partnership? How do you navigate the different priorities people are bringing to the table? The second sort of area of tension that researchers and clients and families identified was around setting those expectations and roles and responsibilities. Oftentimes, you know, clients and families are volunteering to be part of research teams. They have potentially full-time jobs. They have other competing demands. And so, you know, both researchers and clients and families told us this is really challenging. You know, how do we respectfully, how do we ethically and responsibly determine, you know, in partnership, what the roles and responsibilities are for family members in the research process? And then later on in the process, we identified that sometimes data interpretation can be challenging in an area of tension. Again, partners are coming at things from different perspectives, from different experience, different skill sets. So how do you navigate data interpretation in a partnership model? And then lastly, the last tension that we identified was around sharing study results. You know, how and when and where do we share those results? Clients and families might have, you know, certain ideas on what they would like to share the results. They may get really excited and want to share results and make sweeping statements very early. Researchers are often more hesitant to share results and do it in a much more academic way. And so how do we navigate, you know, this challenge or this tension in the partnership? So, you know, armed with the guiding principles and these 4 areas of tension, we were ready to sort of start building our simulations. And we there's a research component to this work that Michelle's going to speak a little bit about. And so we went through the research ethics process, and then we were ready to recruit participants for our simulation build day. And we were able to recruit 2 researchers, 2 research staff members, 3 trainees, 2 clients, and 4 family members to spend an entire day with us to develop these simulations. And so when participants arrived, we broke them up into 3 groups, and we provided each group with one of those tensions one or 2 of those tensions that I just described. And we asked them to do 3 things throughout the day. The first thing that we asked them to do is reflect on the scenario or the tension that they received and share stories about when they may have experienced a similar tension or a similar challenge. And each one of them took some time to share their stories, share their experiences. And then once that was complete, we asked them to create a shared story. So take all the learnings, all the experiences from the story sharing that you just did, and now come up with a story that represents the group's experiences within this tension. And so they spent some time doing that. And then the last thing that we asked them to do was work with professional actors. In the simulation world, we call them standardized patients, and work with those actors to bring that shared story to life, to put it to acting. And at the end of the day, we had 4 scenarios that were acted out by our professional actors to reflect the scenarios and the storytelling that happened at the beginning of the day. And so once we left that day, it was a very full day, but we left that day with 4 simulations. We left with a simulation around finding or identifying a family partner and setting those objectives and expectations up front. We had a simulation around partnering to set research objectives, one to how to navigate concerns around knowledge translation, and then a 4th one on reviewing results with a research partner. So you can see that they map very closely to the original tensions that we had identified as a group. And there's 2 on your screen that have asterisks beside them. So those simulation number 2 and simulation number 3 are the simulations that we're going to share with you in just a few minutes. But before that, I'm going to pass it over to Michelle, who's going to share a little bit about the research that we did as we were going through this co-design and co-build.
Thank you, Nadia. Let me just let everybody know that we're only providing a sneak peek into the research today, and you're welcome to follow up with myself or Catherine or Nadia if you'd like to learn more about these pieces. We're not all the way through the analysis yet, so I can't share our findings, but I will share a little bit about our process. Our objective was to examine how youth, parents, or primary caregivers, trainees, clinicians, and researchers construct their experience of co-building collaborative research simulations. So Nadia described for you what happened in that co-build day and some of the pieces that led to that day. What we were very interested in was taking a closer look at how people engaged in that co-build process as part of a multi-stakeholder group towards building the simulations. So we used a case study methodology with embedded narrative analysis. Our case was at Holland Bloorview, and it was bounded by the people in the process of building the co-build simulations. The narrative analysis came from the stories that people were sharing and then co-constructing about their experiences doing authentic and meaningful engagement and research, but also around their stories of the challenges that they had previously encountered. For data collection, Nadia mentioned we had 3 groups that were working on co-building and sharing stories in the morning. 2 of those were observed, one by myself and one by Samantha Misinski, who is our trainee on the project. So we took detailed notes about the process that we saw occurring in the co-build. We also videotaped those groups that morning and then did some analysis of both the the content that was shared, so the words and stories that were shared, but also the nonverbal and dynamic aspects of the co-build. We did follow-up interviews with a subset of the people who participated in the co-build day, and we aim to, and we're successful at doing interviews with several different stakeholder groups, both to follow up on the narrative analysis themes that we had gotten out of the video data, as well as the simulations, and then talking more in depth with people about their experience in the co-build. So in terms of our analysis, I mentioned the observation, and both observers met the same day to discuss the similarities and differences in what we had observed and to take some memos about things that we thought were important. In terms of the video data, we separately and together coded and did some narrative analysis. And then for the interview data, it's not done yet. We'll be doing some thematic analysis. In terms of outcomes and what we hope to be able to share with you in the future, we will look to publish these results that describe the context and then how members interacted and collaborated, as well as the narrative analysis. And so those stories that people told about their engagement in research, including their reflections on opportunities and challenges. So that's a quick summary. And as I've said, I'm happy to follow up with people about these pieces if they would like to. I'll pass it back to you, Nadia. Or Catherine.
Volley it right over to Catherine.
Okay, good afternoon, everyone. It's lovely to be here with all of you. So very excited to take us through two simulation experiences today. One is actually going to be a live simulation in about 5 minutes. We will have a live encounter on Zoom. And then the other one is going to be a video, as Nadia and Michelle have talked about already. The 4 simulations were generated as resources for the Child Bright community to use as educational tools based on those healthy tensions and those principles for client and family center engagement and research, as Nadia has talked about. So before we dive in though, I just thought I would do a little bit of an information around what exactly is simulation. And I am making no assumptions that anybody on the call has had experience with simulation before. So I will just provide a very, very brief overview around what simulation is. Before I do that, I am going to invite the individuals on the call to grab a pen and paper or something to record for this next session. So I'll give you a little bit of time to do that now. But simulation really, broadly defined, is the authentic recreation of a situation or scenario for the purposes of learning and development and growth. Also of assessment, for the purposes of assessment, or to render judgment on the quality of a performance. We will not be doing that here, but we will actually be just kind of providing you a lived experience of, or a live experience of that healthy tension, so we can have a conversation about what you're noticing and recommendations that you would make. But there are 2 critical characteristics to any simulation. And one is, and I'm not quite sure if you are familiar with the movie Apollo 13. So if you remember, if you saw that movie at all, this was there was a time when the Tom Hanks and the crew were disabled up in space. It was a failed attempt to land on the moon. And because they actually couldn't problem solve or do any type of trial and error up there to solve the many problems that they encountered over those 13 days, Gary Sinise's character, who is shown in the frame here, was actually in a simulator. So the simulation that he was in was an exact replica. Every condition that the astronauts had up in space was recreated down in mission control, where Gary and Gary's character did a lot of trial and error. Everything was replicated. So anything that they didn't have up there was not in the simulator. They actually replicated it to such a degree where they altered the temperature. So after 8 days in space, you can imagine how cold it was up there. And Gary's character said, just drop the temperature. Give me the exact conditions they have up there. And that really is one of the critical elements of simulation, that it is an authentic reproduction of a situation or scenario for the purposes of learning and problem solving. So the next slide illustrates the next kind of element of what simulation is and the great part about simulation. So the other movie clip that we often use to illustrate this is Monsters, Inc. So if you have seen this, or if any of you have young children, you no doubt may have been familiar with this movie. So actually this is at the very beginning of the film. What it illustrates is these monsters who work in this company spend some time in a simulator, which is that of a child's room. So they actually go and they practice the scare tactics in a simulator. And what this frame particularly illustrates is the other critical element of successful simulation, which is the observation of a performance and the capture of that performance using videotape. So you can see in the middle of the frame that the person who is actually running the simulation is video and audio taping the encounter. So the three monsters at the front of the screen are actually just taking notes, and they'll have an opportunity to review the performance of the monster who's in the sim using that videotape. For the purposes of deep learning, so the other critical element of the simulation is a debriefing. So because really when you're watching the simulation, the learning occurs in the discussion following the sim. So the other critical piece that we'll be illustrating today is you'll have an opportunity in breakout rooms in a little bit to actually debrief with some reflection questions that we will post in the chat. You'll have an opportunity to do some debriefing around what you saw. So, because really that's where the learning occurs in that facilitated conversation. So that really is a general overview of what simulation is. So next slide, I will just, again, as you continue to use these, or as you start to use these simulations in your own context, we wanted to make explicit our process of how you can use them. So this is what we're actually going to do in the live sim now. So we just gave a little bit of an introduction around what simulation was, and we're going to set up the simulation. What we're going to do is you're going to read what's called a STEM. And a STEM to a simulation is really just enough information for you to understand what's going on. It's typically an introduction of who's going to take place in the simulation, and just the context, why they're meeting, what they're meeting about. So that you have a sense of, as you join this conversation that you'll see, you'll know who they are and why they're having a conversation. So our hope is for you to watch the encounter between Mary, a mom, Kim, a PhD student, and Dr. Villasor, who's the researcher and Kim's supervisor. I'm going to show you the STEM in a moment, but again, I'm just going to really invite you to really as you view that simulation, if there's something that somebody says or does that really resonates for you, jot it down, because that will really help you in the debrief. Following the sim, we're going to place you in breakout rooms for about 10 minutes. And again, we will post the discussion questions for you in the chat. After that, we'll have you back into the larger room, and we'll do what we call a group harvest. So we're actually going to ask you to choose somebody to record the discussion in your breakout room and report back only on one of the questions that we'll be talking about. And we'll go through that in a minute. So the next slide is going to show us really what the STEM is. So if we can move to the next slide. Back up, one more thing as well. Again, just to kind of ground us again in why this simulation was created. So those moments of tension and those guiding principles for client and family engagement and research. This particular simulation is around navigating concerns around knowledge translation. So the hope is that after the simulation, the people who either view the simulation or step into the simulation and have a conversation with Mary and Kim are able to really think about what knowledge translation activities or products can be created to ensure that the priorities of everyone on the team are adequately addressed while ensuring the integrity of the research process is upheld. And how do you navigate discussions around co-authorship with family partners when the individuals on the team have very different hopes and wishes coming out of that research? So that's really the learning objectives that this simulation was meant to address. So the next slide, here is the STEM. I will read it for you. And again, you have a pen and paper, hopefully. So if there's anything about this STEM that you would want to jot down, please do so now. So Mary, a family partner, has been working with Kim, a PhD student, on phase 1 of Kim's PhD research for 2 years. Phase 1 is a pilot study which examines the feasibility of a group-based early literacy program for children with disabilities. The pilot study is complete and the results are ready for publication. Dr. Villasor, Kim's supervisor, Kim and Mary meet to discuss next steps for publication and knowledge translation. So I'll invite Mary, Kim, and Dr. Villasor into the room to start the conversation.
That brings us to the end of the recorded content for today's webinar. What is not shown here is that during the session, the facilitator showcased 2 of the simulations. One was performed live with a set of actors and the other via a video recording. For the live simulation, the audience was then split into smaller breakout rooms and tasked with reflecting on the scenario to unpack what went wrong and what can be done better to address the conflict. Specifically, during these smaller breakout sessions, participants were tasked with answering or reflecting on how the simulation made them feel, how the encounter could have been improved, and lastly, what specific recommendations could be made to the research group that were demonstrated in the simulation. Please stay tuned, as these learning tools will be launched in the near future for you to use within your research teams. With that said, this brings us to the end of the recording for this session of the 2020 Childbright Summer Learning Series. Thank you all for attending, and of course a special thank you to our facilitators, Nadia, Catherine, and Michelle, along with the cadre of actors who brought life to the scenario that was demonstrated. Additionally, please check back with Childbright over the summer, as further entries in the learning series are expected to be announced in the coming weeks. Lastly, if you have any further questions, please don't hesitate to connect with us via the displayed email address on your screen. Take care, and we look forward to connecting again with you real soon.